I am Dr. R.P. Agrawal, Senior Professor, Incharge Diabetes Care and Research Center, S.P.Medical College, Bikaner. I came to know that Sangamithra is organizing one conference, very wonderful conference, that is role of camel milk in autism and diabetes. I tell you, there is a great role of camel milk as an adjunctive therapy in type 1 diabetes as well as type 2 diabetes. We carried out several research, particularly on the experimental part, clinical part, epidemiological part, proteomics and genetics, and reached to the conclusion, particularly in experimental part, when we induce diabetes in albino rats, there is significant reduction in the blood sugar by adding camel milk to the albino rats receiving the camel milk. The blood sugar came down. After that, we carried out some clinical studies. Initially, we carried out role of camel milk in type 1 diabetes for a month, and there is 30% reduction in the dose of insulin. That paper we presented at the International Conference of Physicians at Japan, and that paper was awarded. After that, we carried out 3 months study, 6 months studies, 1 year studies, and 2 years studies, very long-term studies. In 2 years studies, 4 children out of 12 was significantly reduced the dosage of insulin to the tune of 60 to 70%. And to the surprise, 4 children out of 12 were without insulin. They were totally controlled on camel milk. That was a very remarkable research in type 1 diabetes, because there is a great needle phobia in type 1 diabetes. So if we can withdraw the needles from the management of type 1 diabetes, that will be a great research. Then with the help of Indian Council of Medical Research, we carried out research in type 2 diabetes. That was a blind studies, double-blind study, because the results were analyzed at NIN Hyderabad. They were not knowing which group received camel milk, which group do not receive the camel milk. And in type 2 diabetes, by significantly reducing the insulin resistance, it helps in type 2 diabetes. Then we carried out proteomic studies. We isolated the protein from the camel milk, and 22 proteins, 17 peptides were similar to insulin-like molecules. That is again a good research, that we isolated the protein from the camel milk, and they are having similarity to the insulin-like molecules. Then we carried out epidemiological studies. There is one community, Raika community. They judiciously use the camel milk in their diet, and the prevalence was less than 1% in that community. While the same kind of environment doing the same kind of work in other community, the prevalence is around 5%. Again, that is because of camel milk, because they use judiciously camel milk in their diet. Then we carried out genetic studies in that community. There is no protective genes in that community. That again favors there is a role of camel milk in prevention and treatment of type 1 diabetes. I wish this conference a great success. Full team of Sangamithra wish all the best. Thank you. Thank you very much.